Welcome to my YouTube channel. My name is Nasan, and today I want to talk about the side effects of chemotherapy. It is always good for you to know what are some of the side effects that I'm expected or my family member or my friend is might experience during this process before you start chemotherapy. Therefore, remember to subscribe, share, and like my YouTube channel for more information. As always, I've always said, if you plan to have a family in future, before you start chemotherapy, kindly ensure you talk to your doctor about it so that your sperms or your ovum can be harvested to enable you have children in future. Don't keep quiet and start chemo medication without talking about your fertility issues, because definitely most of cancer medication have fertility issues. You might not be able to conceive or fertilize a woman for several years after chemotherapy. Also, before you start your chemotherapy, you also need to know that you are not supposed to have unprotected sex. Ensure you use condom during treatment and use contraceptive after several weeks of treatment. Also, ensure that you don't conceive during chemotherapy. Yeah, it's not safe for you to conceive during this time of treatment. Straight to the point. What are some of these side effects that you might experience when you are receiving chemotherapy? Includes chemotherapy effects to the blood. There is low white blood cells. When you start receiving chemotherapy, your white blood cells are likely to go low, and therefore you are going to be predisposed to infection. This is because white blood cells helps to fight infection in our body, and when it goes down, it is automatic that you are going to get what we call neutropenic sepsis. It's sepsis that is brought due to low white blood cell, and therefore you are going to be in and out of the hospital because of other conditions apart from the cancer that we are treating. It is always good for you to always check your blood level before you start chemotherapy and even after you have finished the session of chemotherapy. Always ensure that you check your blood temperature. If it is above that 8, it is always a signal or an early sign to show that you have infection. If you have a cough that is yellow or greenish in color, it's not a good sign. And also ensure that you report any abdominal pain, any abdominal pain, and what we call pain on urination, that is urinary tract infection and so on. If you have painful menstruation and low abdominal pain, ensure that you report. These are some of the early signs of infection which might be caused due to low white blood cell. Also, chemotherapy affects platelets, and platelet in body helps the clotting, your blood to clot, to prevent bleeding. When your platelet goes down, you are likely to bleed more easily. So ensure that you avoid bruises during chemotherapy or trauma, and also ensure that you check your blood levels prior and after chemotherapy to know if your clotting factors are okay or if there is any problem. There is also reduced red blood cells. This is now whereby this patient will need more transfusion or frequent transfusion to replace all these factors that I'm talking about. There is reduced red blood cell, platelets, and also white blood cell. So this patient will need a replacement of red blood cells so that they can continue getting what we call their chemotherapy. Remember that red blood cell dies after some time. Our body manufactures red blood cells more frequently, and chemotherapy, as we know, it destroys the cancer cells and the normal cells. So if the normal cells are affected, then means that our red blood cells will also be destroyed or be low than expected. So they'll need to be replaced most of the time to enable the patient go on with the treatment. Another side effect of chemotherapy includes sore mouth. As you continue receiving your chemotherapy, you will start having sore mouth. You might even have some wounds in your mouth. This This is one of the factors that affects patients. Even their eating or drinking, hydrating becomes a problem. Actually, ensure that you gargle with salty water like 4 times a day. It's going to help reduce the pain. And also ensure that you use soft toothbrush or electric toothbrush. You can do it twice a day. And also ensure you avoid alcoholic based substances like brushing your teeth. Don't use substances that has alcohol in it, because it is so irritating and it makes it more uncomfortable than you expected. You are going to see white patches in your mouth. Actually, this is due to this effect of chemotherapy. And also I advise that ensure you check your dentist. You visit your dentist prior to chemotherapy. Ensure that your dental issue have been solved before you start chemotherapy, because you are going to have this effect of sore mouth depending with the type of chemotherapy you are receiving. Another side effect is hair loss. Whether you are a man or a woman, you are going to have an hair loss, and it has a big impact when it comes to a woman. For men, it is a bit tolerated. It's taken more positive than when it comes to women, because we women, our beauty lies in our hair. So these are some of the things that we need to have told you. Actually, pre-counseling is very important. All mothers, all patients actually who are going through chemotherapy, they always need pre-counseling and be prepared for all these signs of chemotherapy. And hair loss is one of them that makes them to have low self-esteem. Ensure that you can use a wig to help you, or a scarf to help you cover your head, just in case you feel like you need to cover your head, and it is going to help you. Also ensure you ask your doctor if the medication he or she is going to give you is going to have an effect on hair loss. Actually, not all chemotherapy medication have hair loss, few of them, but it's always good for you to inquire if it has an hair loss effect on you. Also, this happens within 2 to 3 weeks, not immediately. 2 to 3 weeks you'll start feeling like now your hair is falling off, and one day you just wake up and a massive of it is falling. What are you supposed to do? Ensure that you avoid blow drying or heat on your head, and also avoid curling. Electric curling will increase the effect than expected. Use a large comb, a toothed comb, that will reduce the impact on the air. Use the shampoos that have the correct or low pH if possible, because the shampoos have different pHs. Look for those ones that are suitable for the patient who are receiving chemotherapy. Ensure that if you are in an institution that can give scalp cooling, it is also very important. Scalp cooling can reduce the effect of hair loss. But if it happens that it has gone, ensure that you cope with it. You can decide to face the situation and go out like that, or you put on a scarf. Ensure that you follow what I've already said. There is also what we call constipation. Constipation also will come in depending. Some will have constipation, some will have diarrhea. So just in case you have constipation, it is part of side effect of the chemotherapy. Ensure you take a lot of fluid to help you soften the stool. Take a lot of vegetable. Do some of the activities to help motility, the movement of food in the body, to move very quickly. Also, ensure that you talk to your doctor like you are having a constipation or you are having this problem, so that if there is any medication like laxative can be prescribed to help you pass stool, because constipation can make you uncomfortable. You need to eat, you need to be strong for the chemotherapy. If you are not eating well, you are not going to be strong, your blood level will go down, and therefore chemotherapy will have to stop at a point. So eating is not an option. You have to eat. Whether you have a sore mouth, you have constipation, you have to look for ways that will enable you to eat and finish this treatment of chemotherapy. There are also what we call diarrhea. Diarrhea is, you can either have constipation or diarrhea. Now, if you have diarrhea, if you have more than 4 times loose stool in a day, contact your doctor and seek for advice. Ensure also you hydrate very well, because you are losing a lot of fluid during diarrhea. Ensure you are taking in a lot of fluid. Fluid of your choice. It's going to be so helpful. There is also what we call skin changes. Your skin may become so rough and scaly during this time. It is expected as one of the side effects of chemotherapy. So also your nails, your veins, and your gum are going to be dark in color, but they regain their color after some time. Don't worry, it's just side effect of chemotherapy. There's darkening of the nails. It will go away. So ensure that you hydrate yourself very well to keep your skin well hydrated. You use a sunscreen cream that will help prevent the sunburns, because the skin is already compromised. So you don't have to go on the hot sun without covering yourself. Ensure you cover your head when you are on the sun or when you are outside. Avoid being in a place that can cause trauma to the skin, and so on. So it is always good for you to take care of your skin to avoid any trauma, because we have said the chemotherapy lowers immunity. So if your immunity is low and you have wounds, the healing is going to take longer than expected. Another side effect is mental health. Most patients are affected mentally once they are diagnosed with cancer. And it even becomes more worse when they are told that they are going to start radiotherapy and chemotherapy. And they need really support. They need to be assisted mentally. So these are some of the side effects that comes in without noticing. So it is always good for a patient who has started chemotherapy or radiotherapy to talk to people. Talk to someone that you trust, that who can listen, who are willing to listen. Talk to your doctors, talk to your nurses how you are feeling. It's going to help a lot. Actually, it is also good for you to join a support group. A support group is going to also help you cope with this condition. They're also going to give you advice like, I had this problem and this is what I did. You can do this, you can do this. It is going to be help a lot. Also be careful of information you get, because not all information are healthy. If possible, support group are guided by the doctors and nurses, and they meet like once or twice a week or a month. So I'm confident that most of the information we are going to get in cancer support group are going to be valid to you, and most of them have already suffered the same problem, so they are just giving you some of good tips that help them to recover. So ensure that you are talking to the right people. Get counseling. If at a point in the middle of session you feel like no, you need counseling, you need someone to listen to you, always ask your doctor to call a counselor for you and talk about it. We should never ignore, because most of our patients go through a lot of trauma. There is also risk of bleeding. We talked about low platelets. Low platelet will predispose you to bleeding. You'll find that most of the time you might be bleeding easily, like when you brush your teeth you are bleeding, when you wipe your poop you are bleeding, something like that. So it is always good to be vigilant to see if you are nose bleeding, gum bleeding, or any bruises. Talk to your doctor as soon as possible, so that we prevent more infection, and also we prevent losing a lot of blood. There is also risk of blood clot. Blood clot can also be another effect. Ensure that your blood level are checked more frequently, so that we avoid this complication. There is also what we call allergic reaction. You might react to the medication you are getting, which might not have happened immediately. Maybe once you are at home, or after several weeks, you feel like you have difficulty in breathing, itchiness, rashes, you feel like itching, you feel like there is facial flush and hotness. Always remember to call your doctor, talk to your doctor how you are feeling, just in case there is such a reaction that has happened to you. There is also another side effect, what we call peripheral neuropathy, whereby you feel numbness, you feel needle pains, or you are not feeling anything at all. There is loss of sensation. Ensure that you talk to your doctor, especially when it is during the process of chemotherapy itself. You can talk to a doctor immediately so that they can reduce the dosage, because it might be due to high dosage. So if it is after chemotherapy, that one you can give it time. If you have finished chemotherapy already, give it time, your body will regain its senses slowly. I said chemotherapy destroys normal cells and the cancer cells, but the normal cells will start regrowing or start growing again. So you give your body time to recover slowly. It will actually recover. So ensure that you don't keep quiet if you have any of these side effects. Actually, some of them go through chemotherapy without much side effect, but most of them it is horrible, actually horrible. So it is good for you to prepare yourself psychologically that this is what I'm likely to experience during this process, and it is always good to seek medical counseling before you start chemotherapy. Another side effect is nausea. Nausea is one of the most common side effects of chemotherapy, whereby patient feels nauseated and feels like vomiting what they are eating or what they have eaten. It is always advised that you take medication, antiemetic medication like dexamethasone, and some other steroids that will help reduce this urge of nausea. It is always advised that you take this medication earlier before taking your meal, so that during the time you are taking your meal, the effect of medication has already started, and therefore you are going to reduce the chances of you vomiting. If you wait and start vomiting, this is the time you are taking this medication, it's not going to work. This is because you might vomit the same medication that you have taken in, unless it is an IV medication. So ensure that you take your medication earlier before the meal. Also ensure that you take regular, small but frequent meal. Don't take a large meal at the same time, because if you take a large meal, it is also going to predispose you to vomiting. Ensure that you hydrate yourself more frequently. When you hydrate yourself, it reduces the chances of you feeling like vomiting. Also, it is known that ginger tea or ginger drinks reduces the nausea effect. So you can prepare any drink that has ginger in it. If you don't have the side effect like hyperacidity, then it's also going to help you reduce the side effect. Another side effect is a taste and smell. You might end up losing your taste and smell. So taste and smell are affected in different ways. Some of them, they don't taste at all, but some of the patient have very sensitive they are very sensitive to smell or to taste. All of them are affected. So therefore ensure that you take hard sweets. You chew most of the time to help reduce this effect of not feeling the taste or smell. Also ensure that you take different type of food that makes you better, that makes you feel. You can take like citrus. If you are not affected, take citrus, foods that will help you have taste. You can as well increase your spices in your food if possible. If it's not contraindicated, you can increase your spices in your food to help you start having taste. But if you have high sensitive to taste and smell, now you can end up doing the opposite. You can reduce the ingredient and reduce on what I have already said. There is what we call fatigue. Fatigue is also a major side effect of chemotherapy, especially after first few weeks of chemotherapy. You'll feel like you are so tired and you don't feel like doing anything, and yet you have not done anything that might make you tired. It's normal during chemotherapy, but there are some of the ways that are going to help you cope with it. Ensure that you do some exercises during the day, at least to keep yourself busy and to keep your body strong. It is going to help you a lot. Also ensure that you make a diary of what you are going to do today at what time. Ensure that you do your activity at the time that you usually have good energy. If it is during morning session you feel that you are more energetic, ensure that most of your activity are planned in the morning. If it is at afternoon or what time you feel that you are more energetic, please have a diary, plan your things according to your energy level. Don't wait until you cannot do anything and you feel like you are being a burden to the family or so on. Fatigue is part of side effects, and always you can have a way to control it.